Hi, my name's Paul Shortier with American Senior Benefits. I'm here today to talk to you about how we help folks with Medicare. American Senior Benefits is a group of independent insurance agents, and our home office is in Kansas City, Kansas. And by being independent, what that means is when we help folks with Medicare, we don't represent just one insurance company. We're licensed with all the Medicare providers. So in Connecticut, for example, I'm licensed with United Healthcare, Anthem, Aetna, and some of the local companies like Connecticut and Care Partners, and WellCare is another company that we're licensed with. So what we do is we meet with people and we help them understand Medicare, the decisions that people make, and how we can help them make those decisions based on the drugs they take and the doctors they go to. And let me tell you, nobody's better at explaining Medicare than myself and the people that I work with. I tell people, by the time we're done, you're going to be able to explain Medicare to your next door neighbor. And people laugh about that, but I take it personally. It's my job to get people to understand Medicare. So most people say, why do I need help? Why do I need help with this? Well, the advantage of having somebody like me help you is I will collect your prescription drug and doctor information and help you figure out what your best deal is based on the drugs you take and the doctors you go to. And we are paid by the insurance companies, so it doesn't cost you anything to have somebody like me help you. So what that means is we can go through the whole thing. I can help you understand what your best deal is based on your particular situation. And when we're done, you could sit there and say, all right, Paul, let me think about it. People ask, why do I need your help? And what I do is I help people figure out what their best deal is based on the drugs they take and the doctors they go to. And we could sift through the whole thing and I could tell you your best deal is, this Aetna plan. And at the end of the day, you could say, all right, let me think about it. And you never call me back. You just sit there and say, you know what? I didn't like that guy. I'm just going to do what he told me to do. You get the same deal no matter if I sign you up for it or if you go and do it yourself. The advantage of having somebody like me do it is stuff changes. The decisions that we make now based on the drugs you take and the doctors you go to may be different a year from now. Your doctor may prescribe a new drug for you and you might be going, well, I was getting a great deal on all my other drugs and this new one I'm getting hosed on. Every year, you're going to get a letter from me that reminds you, open enrollment is October 15th through December 7th. Now's the time of year when you can make changes. You call me up and you go, hey, Paul, remember that plan we picked last year? Well, halfway through this year, my doctor prescribed a new drug for me, and it seems like I'm getting hosed on it. In October and November, I take a look at it with you and I say, yeah, you are getting hosed on it. Some of the other companies are going to give you a better deal. Let's get together and figure out what changes you should make for the following year. So what we do is we help people understand Medicare. And the piece that I use is a piece from United Healthcare called Medicare Made Clear. And that is the best piece available for helping people understand Medicare. If you flip through that 24-page document, you will see that United Healthcare's phone number is nowhere in that piece. Page 19, I think, shows the phone numbers in there are Medicare, Social Security, other numbers, government numbers like that. But United Healthcare's phone number's not in there. The piece is entirely on understanding Medicare. And what I tell people is page 5 of the Medicare Made Clear brochure is your roadmap. And when you look at the roadmap, I've created a summary of the roadmap, and that's what we're going to talk about right now. So, there are basically 2 steps to Medicare. Step 1 is you got to enroll in Medicare, Part A and Part B through the government. Medicare Part A is what's referred to as hospital insurance, and Part A covers hospital stays and inpatient care. Part A doesn't cost anything, but If you're turning 65 in October of 2020 and all you did was step one, so in other words, all you had was your Medicare card, and you went and had a hospital incident and you stayed in the hospital, there's a $1,408 deductible per hospital stay. So in other words, if on October 1st, all you had done was step one, and on October 2nd, you spent one night in the hospital and they said it was $500, you owe $500. If in November you go in the hospital for a week and they say it's $10,000, you owe the whole $1,408 deductible. If you go in the hospital again in December for a week, you owe another $1,408 deductible. So that's Part A, hospital insurance. Doesn't cost anything per month, but there's a $1,408 deductible per hospital stay. Medicare Part B is what's referred to as medical, and that covers doctor visits, lab tests, x-rays. So it's doctor visits and outpatient care. So doctor, lab tests, x-rays, MRIs, and if the ambulance comes and picks you up and takes you to the emergency room, you went to the hospital, but you came home that day, you didn't stay at the hospital. So an ambulance ride and an emergency room visit would be Part B, okay? Medicare Part B is not free like Part A. It's got a $144.60 a month premium that they take out of most people's Social Security checks. Or if you're not collecting Social Security, they bill you on a quarterly basis. Medicare Part B also has a deductible. It's $198, but it's just once a year. Not like Part A, every time when I stay at the hospital, I owe the $1,408. No, Part B, $198 deductible once a year. But then Part B only covers 80%. So for example, if on October 1st, all you had done was step one, you only had your Medicare card, you never did step two, and you went and got a $500 MRI on October 2nd, you owe the first $198, and you owe 20% of the remaining $302, $60.40, or whatever that is, okay? If you go get the same MRI in November, the $198's gone, now you just owe 20% of the whole $500, okay? So now we get to step two. Do I need additional coverage? Well, the answer for most people is, yeah, I need additional coverage. I don't want to pay $1,408 every time I stay at the hospital, and I don't want to pay 20% for all my Part B services, okay? There's no cap on the 20%, okay? What if you had outpatient chemotherapy and they said it's $500,000? I owe $100,000? There's no cap on it, okay? So I need something to take care of the $1,408, and I need something to take care of the 20%, and Part A's hospital, Part B's medical. There's no mention of me going to Rite Aid or CVS or Walgreens to get my drugs. That's Medicare Part D, as in drugs, okay? So, yes, I need to do step two. Now, here's the boat that people miss. There are two ways to do step two, okay? And what happens is people get their Medicare card and they just start shopping. And it's like, what are you shopping for? Are you shopping for this? Are you shopping for Medicare Advantage? Or are you shopping for Original Medicare? And they give me this look like, what are you talking about? You know, you got to understand, I get my Medicare card, I want to do step two, but there's two ways to do it. And that's my first decision. Which way do I want to do step two? And that's what we're here to talk about. And that's the most important part of understanding Medicare. The two ways to do step two. So if you look at the piece on the screen, it says that there's option one or option two. And I always think of this as a right-left thing, okay? Option one is what we call Original Medicare. And option two is what we call Medicare Advantage. And think of this, that line up and down on the page that separates option one and option two, I always tell people to think of that as a fence. And you're either on the left side of the fence or you're on the right side of the fence, okay? And the thing about the fence is everything's opposite. If it's up on the left side, it's down on the right side. If it's black on the left side, it's white on the right side, okay? The left side, original Medicare, is an a la carte arrangement, okay? Everything's separate, okay? I carry my Medicare card around with me, and I get a separate, all by itself, supplemental plan to take care of the $1,408 and the 20%, and one plan takes care of the $1,400 and the 20%. But then I got to get another separate plan to take care of prescription drug coverage. And then I got to get another separate plan to take care of dental and vision if I want it, okay? The right side of the fence, Medicare Advantage, is an all-in-one deal. It's not a la carte. It's exactly opposite. It's all-in-one. And the way that Medicare Advantage works is private insurance companies like Anthem, Aetna, United Healthcare, they take over my Medicare for me through these government-approved Medicare Part C plans that include prescription drug coverage. Okay, so what you got to understand is left side, original Medicare a la carte arrangement versus right side, Medicare Advantage all-in-one arrangement. Okay, and the disadvantages and advantage to both sides of that fence. And remember, everything's opposite. So all the advantages on the left side are the disadvantages on the right side, and all the disadvantages on the left side are the advantages on the right side. Let's do the right-hand side first, Medicare Advantage. How do these all-in-one Medicare Advantage plans work? And this is where Medicare Advantage is where private insurance companies like United Healthcare, Anthem, and Aetna take over your Medicare for you through these government-approved Part C plans. Okay, what are the disadvantages to Medicare Advantage? Well, number one, you've got networks of doctors. Okay, you can only go to doctors that are in the plan's network. Okay. Or if it's a PPO, you can go out of network, but they charge you more. So there's a network of doctors, but I can go out of network, but I'm not going to get as good of a deal. Okay? Another disadvantage to Medicare Advantage is a bunch of these plans are zero premium. Even though these plans are charging me zero premium, I pay co-payments for everything. So in other words, when I go to the doctor, I pay $5, $10, $20, whatever they tell me, primary care doctor visit. When I go to a specialist, I pay whatever the plan says, $40, $45. When I go to the emergency room, I pay $90. If I go for an ambulance ride, maybe it's $200, $250. If I go into the hospital, the plans are going to say, it's $450 a day, but you only got to pay for the first 4 days. So I'm sitting there going, okay, hold on a second. One night in the hospital is $450, two's $900, three's $1,350, four's $1,800. But if I stayed for 2 weeks, I just pay $1,800 because I only pay for the first 4 days? That's right. But if you go in the hospital 2 months later for another week, you owe another $1,800. And if you go in the hospital 2 months later for another week, you owe another $1,800. But the plans have caps, maximum out-of-pockets. You stop paying at whatever the maximum out-of-pocket is, $5,000, $6,000. The highest they can be in 2020 by law is $6,700, okay? What are the advantages to Medicare Advantage? Some plans are zero premium, okay? I can get a zero premium Medicare Advantage plan. And the other advantage is I get much better deals on dental and vision. Okay, some of these plans are going to give me free dental, $1,000 of dental. They're going to give me money to buy glasses. They might give me a co-payment or maybe even a free eye exam. Okay, that stuff you're not going to get as good a deal on original Medicare. So let's go to original Medicare. Okay, original Medicare, everything's opposite. So the disadvantage on Medicare Advantage of I got to go to doctors that are in the network, there is no networks with original Medicare. I could live in Connecticut and go see a dermatologist in Alaska. I can get on a plane on October 2nd to go see a dermatologist in Alaska. Nobody tells me where I can and can't go. I can go to any doctor that accepts Medicare. Can't go to France. There's no Medicare in France. Medicare is a United States thing. I can go anywhere where a doctor accepts Medicare, okay? I can go to Boston, I can go to New York, I can go to Florida, I can go to Alaska, I can go to Hawaii, okay? Another advantage to original Medicare is I have a fixed cost, okay? Not like with Medicare Advantage where I got to pay every time I do stuff, okay? In Connecticut, if I pay $160 for a Medicare supplemental plan, I can go in the hospital 10 times and never pay a dime, okay? So if I'm in Medicare Advantage and I go in the hospital 10 times, I'm gonna hit the max amount of pocket. I'm gonna pay $6,700, okay? The disadvantage to original Medicare is nothing's free. Over in Medicare Advantage, I could get a plan for zero, a zero premium Medicare Advantage plan. Nothing's free with original Medicare. I got to pay in Connecticut. I can get a good deal on a supplemental plan for $160 a month, and I got to get a prescription drug plan even if I don't take drugs, okay? In Connecticut, people can get a prescription drug plan for $13 a month. Okay, but if I'm a marathon runner and I've never taken a drug in my life, I'm like, I don't want to pay $13 a month. I don't take any drugs. But if I don't pay that $13 a month and get a Part D prescription drug plan, the government's going to charge me a penalty if I ever need one later. So they basically force me to get a prescription drug plan. And another disadvantage is the deals on dental and vision for original Medicare aren't nearly as good as they are with Medicare Advantage, okay? And the reason is because with original Medicare, the companies that's selling me this standalone dental and vision plan, all they're trying to do is make money on dental and vision, okay? The rest of my health doesn't have anything to do with them. So they're gonna sit there and say it's $50 a month, or something like that. And if you haven't had dental, there's waiting periods. We're not going to do any cavities for 6 months. We're not going to do any crowns, root canals, and crowns, root canals, and bridges for 12 months. Okay? Over in Medicare Advantage, why are they giving me such a good deal on dental? Because the company, let's say United Healthcare or Anthem or Aetna, is trying to keep me healthy. And what they're doing is they're saying, we want to keep Paul healthy, and one of the ways to keep him healthy is to give him a good deal on dental. So, because if I've got a bad pair of glasses and I'm driving around at night getting into car accidents, they don't want that to happen. They want me to have a good pair of glasses and not get into a car accident, okay? If I got a bad tooth and it's infected and I don't want to get it fixed because I don't have dental, that's what they want not to happen. They want me to get the tooth fixed and it not end up infected and end up in the hospital. So the most important decision that people have to make after they get step 1 done is deciding which way they want to do step 2, okay? And the thing about it is, you may have already kind of figured this out, Medicare Advantage is for people that are relatively healthy. Okay, I will talk people out of Medicare Advantage plans. If somebody says to me, I got cancer, I got an AFib, I was in the hospital 5 times last year, I say, yeah, Medicare Advantage is not for you. You want to be original Medicare. I never talk people out of original Medicare. If the marathon runner comes to me and says, hey, I want to be original Medicare, I would look at him and say, in my opinion, Medicare Advantage is perfectly appropriate for you. But if you want to be original Medicare, good for you. Nobody complains on original Medicare, okay? And everybody ends up on original Medicare. There's no 90-year-olds on Medicare Advantage, or at least they're few and far between. Most people, at some point in their lives, say, yeah, this Medicare Advantage isn't working for me anymore. I spent a whole bunch on copays for services last year. So wrapping things up, what I would recommend is that you call us up and you have us go through Medicare with you and help you figure out how we can help you make decisions. And like I said, based on the drugs you take and the doctors you go to, we can certainly help you navigate through the Medicare process. Thank you very much.